measuring wrist flexion, patient will be seated, elbow on table, hand in the air. An alternative way of performing this measurement is simply having the patient's arm hanging off, or their hand hanging off the table, being able to perform full range of motion of both flexion and extension. But for this, we'll have her elbow on the table, hand in the air. So to measure wrist flexion, what we want to do is we want to first find the ulnar styloid, and that is the prominent bony landmark on the lateral aspect of the wrist. Just go distal to that, and there's a little notch, the triquetrum. So place the axis of your goniometer on the triquetrum, the movement arm on the lateral aspect of the fifth metacarpal, and the stationary arm on the lateral aspect of the ulna. So go ahead and perform wrist flexion for me, Rach. So here we are looking at 75, 76 degrees. An alternative way of measuring this is to have the axis on the capitate, the stationary arm between the ulna and the radius, and your movement arm on the lining up with the third metacarpal. Go ahead and perform wrist flexion range. And it'll look something like this. So we're looking once again 75 degrees. It is important to note that both of these, they are done in the clinical setting, both of these measurements, ways of measuring, but they often provide different results. So whatever you do, make sure that you're consistent in your measurements.